Welcome to the EHC podcast on women and bleeding disorders. Today we are going to discuss the European principles of care for women and girls with inherited bleeding disorders, more specifically period management, with Evelyn Grimberg and Marion Bräuer. Evelyn, can you please briefly introduce yourself?
Yes, thank you, Zita. My name is Evelyn. I'm from the Netherlands and have the bleeding disorder Glanzmann-Thrombasthenia. I'm active as a volunteer as a teenager. Started when I was 18, I think. First in the Dutch NMO, at the youth committee, and later on also internationally. I've been part of the EHC Women and Bleeding Disorder Committee for several years and have been the chair a couple of years, and nowadays I'm part of the steering committee of the EHC. I always promote to talk more about women-specific issues, but also about the rare bleeding disorders. And I'm very grateful that we finally have these principles of care where we can promote this and hopefully get the care for women better.
Thank you, Evelyn. Marion, can you please tell us a little more about yourself?
Thanks, Zita. So I'm Marion. I have severe factor 7 deficiency, which means I have to inject every second day. And I'm a member of the EHC Women and Bleeding Disorders Committee, and also a board member of the Austrian Hemophilia Society.
Thank you, Marion. For the listeners who aren't familiar with such issues, how are periods different for girls and women living with a bleeding disorder? In other words, what's the difference between having your period when you have a bleeding disorder versus when you don't?
I think basically it means more blood. So usually women and girls with bleeding disorders bleed more, and they also bleed longer than women and girls without a bleeding disorder.
Yes, I agree with Marion. That is most of the time the issue. You can see it as a bleeding. Of course, it is a bleeding. So every person with a bleeding disorder has long-lasting bleeding compared to a normal person, and it's also the same thing with the period. And what we experience with women is that you have some kind of rules or schedules about where a normal period should fit in. And if we check those boxes, we do see that it is especially the long-lasting part that it's very difficult to make it stop. So normally it lasts about 5 to 7 days. But what we do see and hear back from women with a bleeding disorder is that it lasts longer than that. Sometimes it doesn't stop for a month or several months, even though it's very difficult to make it stop. And I think this is also because of the tissue that it's in. So if you have a nosebleed or a gum bleed, this is also bleeding with soft tissue, which you cannot press or whatsoever, and only treatment can help with that. So yeah, that is what it makes it different compared to a normal period.
Period should last for around 7 days and not longer. And you should change your sanitary products less often than every 2 hours, and that your blood clots should not be bigger than a euro coin, or like, let's say 2 centimeters in diameter. If that applies to you, then the period is kind of called normal. But if you have it longer or stronger, then it's definitely not how it should be, and it should be managed properly then.
And I can imagine that must be quite a burden for women and girls living with a bleeding disorder. So I'm wondering what the impact of periods are on your quality of life when you're, for instance, a teenager, or when you're already in the workforce as an adult.
Yes, it is really a burden. The long-lasting bleeding gives problems with iron deficiencies. Girls and women get really anemic, which gives a lot of tiredness, and being tired makes it also difficult to function well. So the quality of life of these girls and women are most of the time lower. They have dropped out from school or work, cannot do sports because they are not feeling well or bleeding too much. And it is also a burden on the mental part, so they can become a bit anxious about the heavy periods, the many blood loss, or I remember well from my period when I started having it. I was a teenager. I was 12 years old. Lost a lot of blood, got into the hospital a couple of times because of that. Had a blood transfusion as well. I couldn't really function that well at that time and going to school like the normal hours. I passed out a couple of times because I was so anemic. So these are things that happens, but also can give you some anxious moments or fear to happen again, and also fear for the future. So it does impact a lot, especially not being able to live a normal life with your friends or going out or whatsoever, doing the activities that you want.
I think Evelyn has said it perfectly. Maybe I can add that besides the strong effects like passing out or iron deficiency, it can also affect like your daily life just in smaller ways. For example, if you have a longer way to school or work, like I had 1 hour to go to school, and then the sanitary products, they didn't last for an hour, so I bled through them on my way, which is not really nice in a public transport. And that's a reality that the young girls have to deal with. And it's sometimes it's not that easy to cope with that, and you really have to learn to how to cope with it and get strategies to get around it.
Exactly. So apart from the physical issues that you're facing, and Evelyn, you briefly touched on the mental health aspect. So I'm wondering, and can you please elaborate on how or in what ways heavy periods can impact your mental health?
Yes, of course. Yeah. Well, maybe you can imagine it's also what Marion just said. If you are going to school and you are fearing out of losing too much blood during your trip, 1 hour trip, what does it happen to you? This is also a mental impact. It can scare you out. It can make you insecure. I remember myself that I had some issues at that time identifying myself with my friends because I was totally different things that I had to deal with at that time. I was not able to go out with them every time, for instance, which I really would love to do, but I was too tired or losing too much blood, so I didn't feel well or well enough to do that. And I think another aspect, at least for me, but maybe Marion has much more to say on other stuff, is that I had a lot of fear for the future. So what does it mean for me when I would love to have children? Can I ever have would it be able to have? But also fear. There were moments that I didn't want to go to school because I was too tired, and also had the fear to pass out there. So there are a lot of moments that are more mentally impacting you than also struggling with your body and accepting that you are different and accepting that this is also a part of having a bleeding disorder. For me at the time, it was really a realization that I was different compared to my friends. Although I knew I was 4 months old when I got the diagnosis, and I had a kind of a good life so far, but this was really a big game changer and makes me aware of the risk and the issues that could be. And especially when you're a teenager, you start to figure out who you are, what you want in life, become more independent, and well, this can hold you back for doing that when you're tired, maybe anxious, or not able to go through all these stages that all your friends go through.
Yeah, I totally agree with Evelyn. I think it's partly embarrassment or being scared that if I go swimming, might my tampon hold, or is there a possibility to change it as often as I need? So it's kind of a stress level that's added to your life that others don't have. And also the planning that's necessary, but I think it's also a difference if you have some factor replacement or some treatment option, or if you don't, because compared to Evelyn, I think I was really, lucky, so to speak, because the impact wasn't that heavy, so to say, but still, it affects you once a month, longer than a week usually. So it's really there all the time, and you have it in mind all the time. And for me, I didn't know when it starts, because it's not that regularly in my case. So it's really always in your head. And I think that's the mental part that's really kind of stressful.
Yes, and may I add that you point out something very important, like medication. So we know that medication is not always easy, and it depends on your bleeding disorder if you have proper treatment or not. But what we also experience is that the first lookout for medications is hormonal treatment. But hormonal treatment is also impacting you, especially when you're younger, and it makes changes in your body, but also in your mind. You feel different. And I think this is something that we are not always aware of. When I was 12 and started my period, I needed to go on a contraceptive pill. I became kind of sick of it. I had to throw up. I was like a pregnant woman, crying all the time, didn't know what I had to do with all my feelings. And it's not that everybody experienced that, but many women experience difficulties with getting hormones. And especially when you're so young, I think this is something that we underestimate the impact of it. And it is very easy to give. But I hope that for most of the girls, a proper treatment for stop the bleeding instead of focusing on the hormones would be better. In my case, I didn't have at that time the right treatment. I didn't have a factor that I could use. So it's not always possible, but this is also a big burden for many.
We see contraception as a kind of a treatment, but it's really just suppressing the period, and it's not treating the problem. So it's not actually, in my opinion, it's not really a good treatment, so to say, but it's an option, of course. And for some, it's the only option that we have. But of course, the side effects are, not to be underestimated. Even though I have my factor replacement, I also had to try various contraceptive pills and also other options to find a choice for me. And it still took me 30 years to realize that my period is still too heavy, so that I have to inject more often to treat it properly. So it's a very difficult and also a very individual problem that should really have enough focus, and that every woman and every gynecologist should put a lot of focus on.
Thank you. That's very interesting. I love, Evelyn, how you touched on the issue of identity, which is actually much deeper than I expected this conversation to go. But this is what we are here for, to learn, right? Because people who do not live with a bleeding disorder, I think we have a hard time understanding what you're going through. And without your stories, it's real hard to imagine. Moving on, the two main principles in the principles of care are education and management, and also the early recognition and optimal management of bleeding. In an ideal world, while fully acknowledging that unfortunately we do not live in an ideal world, but in an ideal world, what should happen to manage the first period?
In an ideal world, I think the whole family would be prepared before the first period starts. So everyone knows what could be coming or what will be coming. And there would be treatment options on the table. And there would also be options on how to deal with it in everyday life. Like, what possibilities do I have in terms of period pens or whatever. There's so many products like to be prepared there. And I think in a perfect world, there would also be psychological support and also follow up and really a whole holistic approach on the topic, like managing and also, of course, monitoring and then managing the iron and iron deficiency, and hopefully not get to iron deficiency. So this would be my ideal of a treatment plan.
Yes, I that sounds great. I wish it was there when I was younger, but that is the
I
way,
wish it was there now.
yes, we are still struggling with it. That's true. In preparation for your first period, I think there must be a team. So we have a group of girls who do know that they have a bleeding disorder. And for these girls, I think a preparation will be very good. There must be an open conversation about it. But that is one of the things that's not always easy. So a period is still something that it's not easy to talk about. So if you can change that and open up the conversation when girls are a bit younger, how can we prepare things, but also let the parents know and the girls know where to look out for. Make them aware of what is a normal period and what isn't. When do you have to call the hospital to get some extra support? Make a plan, as Marion said. So these are just small things. The 7-to-1 rule is a very nice one. What Marion already mentioned earlier, how you can measure if you have a heavy period or not. But there are also scorecards or apps where you can track and put in all the information about when do you had your first, when does it start, and then you can track how long it lasts, how often you change your pads or whatever you use. Some apps also have something about the pain score and the mental part, and then take that to your doctor and share it and talk about it, go through it, how you do feel about it. Is it measurable? Is it handleable? And maybe what can you do to change? And is there a different options? Please don't scare them out, because that is not necessary. But just an open conversation, talking about that it's a normal thing, that's part of life, and that we can approach it, and what you can do yourself. I think that would be very helpful for to prepare for a period.
I think it will also be good for doctors, because you said have an open conversation about it. I think it would be nice if doctors asked more in that direction, because I was only asked, how do you manage with your period? Is everything all right? And I was like, yeah, it's fine, because it's the only period I know, and it's, well, in my opinion, okay, I can survive it, so it's fine. But I would have wanted more specific questions, like how long does it last? How heavy is it? How bad is the pain? How much school do you miss because of the period? Like more specific questions, so that we as patients start thinking about that, because for us, that's the normality. It's our reality, and it's hard to see that it's not really normal, or it's not how it should be. So I think for doctors, it would really be important to ask more and to talk more about it, and also to give examples. That would make it a lot easier to have that open conversation, which is really, really important, as Evelyn said.
I totally agree. And what we do hear back and see is that a lot of things is running in the family. So you can think, oh, my periods is this way, but it's the same as my mom or my sister, but they may have a bleeding disorder themselves as well. So I totally agree with you, Marion. We don't know from ourselves how it is. We rely on our friends or on our family members, talk about it with them. So we need these specific questions to get a better overview, for sure. Yeah.
Yeah, I remember when I talked to my friends about it, and I said, oh, I have it really heavy. And they're like, yeah, me too. And it's so, yeah, I mean, heavy for you is not the same as heavy for me. And it's really, yeah, it's different. and very individual.
But that's why it's good to have these tools such as the 721. So you have this pretty objective measure instead of just talking to your friends, which is also important. But again, it can be very subjective. But speaking of open conversations, how would you approach having difficult conversations, for instance, with your partners, with your employers, teachers?
I try to be very honest, maybe not try to tell everything at once, because I think that's not possible. But the most important things, I think it's a good choice to be open about it, because it's also a security issue, so to say. So if the people around me know, in case I pass out, what they have to do, or that I have a bleeding disorder, then it's safer for me. So I think it's a good choice that the closest people around know about it. And I think, yeah, the timing is quite personal, and you have to decide what feels right for you. But for me, I've always, been good with just telling people I have the bleeding disorder, I have to inject, and I have no problems, but sometimes, it's a bit tricky, and it's been fine that way, because I think it's an important part, and also it's about acceptance. Like Evelyn said before, you have to accept that you have the bleeding disorder. I mean, you don't have to accept, but it's easier then if you accept it. But it's not what defines you, and it's not all of you. And I think we have so much more to offer than the bleeding disorder. So it's nothing to be embarrassed or ashamed of. It's just a part of us. And I think seeing it that way and communicating it that way usually makes it not that hard. All of my ex-boyfriends, also all of my ex-chefs accepted it and didn't really, it wasn't a big deal.
Yes, I agree with Marion. It is also something that I learned from my parents. So they were always open about it. I have a lot of bruises as well. So the questions came up a lot to my parents, later on to me, and I still get them often. And I always learned to be open about it and just say having a bleeding disorder. And that makes it easier to have it, or just to open up the conversation. Also, my volunteer work is mentioned on my CV. So when I go for a job application or whatsoever, they will see it. And I get questions about it, of course. On the other hand, I also realized that it's not maybe easy for everybody to do it that way. And it maybe depends on the way, on the work you do or whatsoever. But I think being open about it would, I like it as well. And it makes it easier for me. My job knows, and they are dealing with it very well, and they know that it's right, and it's easier to talk about it. When I think about the talks and the approach with difficult situations or questions with my doctors or specialists, it's not always easy, to be honest. Having a bleeding disorder and dealing with it your whole life gives you a certain perception on situations. And it doesn't mean that it's always the same perception on a situation compared from a doctor's or specialist specific. And I think especially with the very rare ones, the knowledge is not always very nice. So I really have to fully trust in my hematologist. She's amazing, and I know that I can call and that it's always right. But with the gynecologist part, it is more difficult. They have so many different fields they are working with, and the knowledge on bleeding disorder in combination with the issues that we have on this specific one, the heavy periods, but also pregnancy and that kind of stuff, it's limited. So the knowledge is not, it's different, it's limited. And that is sometimes a struggle. And you have to be very tough in your feet, standing tough on the ground to disagree or do differently or have different thoughts and share that. I think we are still lacking in very good gynecologists who are specialized in heavy periods with bleeding disorders. So a heavy period is not only happens when you have because of a bleeding disorder. It can also have a different cause. And gynecologists are very wide. There are so many topics that they need to cover, but bleeding disorders is most of the time not one of them, and they struggling as well, I think, and that makes it not always easy. So therefore, it's also very good to have these principles of care, and hopefully this will be better. But it's understandable. It's understandable that they cannot do everything and cannot learn everything, especially if you have a bleeding disorder that's not that common. And but still, I hope that this will help to make it a little bit better.
Having a specialized gynecologist is important in so many ways. It starts with the periods, but it also it's important when it comes to contraception options. And then it goes on with the fertility issues or no issues and having children. So, and also then menopause. I mean, it's so many steps in a woman's life, and we don't have any specialists on that. It's actually crazy if you think about it. So it would be crucial to have specialized gynecologists.
I totally agree with Marion. It's really crucial to get it and to educate them. And hopefully there will be more stepping up to focus more on bleeding disorders in this field. And we really need them, but not only for the knowledge, but also for the research. There is so much that we don't know yet. Not only on heavy periods, but the things that Marion is mentioning. It's the heavy period. It's the trying to get pregnant, the pregnancy itself, the birth, the menopause. There are so many aspects in it, and actually we don't know that much on it. If we look out for information or research on it, there is a lot that we need to know more. We need them for sure, and hopefully they will step up. And there are just a few in Europe that we already know, and that they are getting more and more interested and doing research. There is research, but it can be better, and hopefully that will continue moving forward in the coming years, and that it will be even better for the next generation. Yeah. Well, as a closure, maybe you heard today about some points like the 7-to-1 rule, the way how you can measure your periods. So if you want to know more about it, of course you can go to Google, but there is also a lot of information at the EHC website. So please go there, and if there are more questions about it, you can always reach out to us.
Great, excellent. Well, thank you both for your time, and thank you for listening. Stay tuned for the next episode.